वो खाना नहीं खाया, चलो आपको जल्दी ना 2 मिनट में बोल के बोलना पड़ेगा उनके बारे में।
गुड मॉर्निंग।
Hello. Hello.
Hello.
Yes, sir. So may I start or there is some?
Just we'll make an introduction. So now we are live, and every people can see see us. Good afternoon, friends. All those audience and students who have joined this semi-webinar. I welcome Dr. Ramjee Singh, sir, who is the chairman for our organization's GD Memorial Homeopathic Medical College, and he is also the president at Homeopathic Medical Association of India. Dr. Ramjee Singh was ex-chairman for the Central Council of Homeopathy, and you must have seen whatever you are studying at present, credit goes to him. So I welcome you, sir, Dr. Ramjee Singh, sir, in this webinar. Thank you. Then we have today a speaker from Kolkata, the most renowned speaker from the world, Dr. Ashok Kumar Das. He was the ex-professor at National Institute of Homeopathy, but for his passion for the research, he greatly involved in the research work. Recently, I was going through his very beautiful presentations on chronic disease, where he has made a very paragraph-wise explanatory notes. I think that this is most useful thing for the students, and I recommend every student to go through this chronic disease commentary by Dr. Ashok Das, because it is in very simple language and every people can understand. Students and friends, you must be aware that Dr. Ashok Das has given you several books. Most of you must be familiar with his Organ of Medicines, Repertory, and many more. So I welcome Dr. Ashok Das ji in this webinar.
Thank you, sir. Thank you.
Yeah.
Good afternoon to
now
everybody.
Now I request Dr. Ramjee Singh, sir, to make a welcome address for this webinar.
थैंक यू डॉक्टर सहानी जी, ये आपके प्रयास से हम लोग इस कार्यक्रम को करने में सफल हुए हैं। खासकर डॉक्टर मनीष जी को भी मैं बहुत बहुत धन्यवाद देता हूं, और मनीष जी को मैं आश्वस्त करता हूं कि हर वीक में हम लोग एक पर्सनालिटी को लेकर आएंगे डॉक्टर सहानी जी के सहयोग से। डॉक्टर अशोक दास जी से मेरी चर्चा हुई, और डॉक्टर अशोक को परिचय देने की आवश्यकता नहीं है, पूरा इंडिया जानता है। और इनसे मेरी बात हुई क्योंकि लास्ट अपने ज़िंदगी के समय में डॉक्टर ललित वर्मा ने इनको याद किया, और ललित वर्मा ने मैसेज दिया कि डॉक्टर अशोक दास से बात कराइए, लेकिन वो बात नहीं हो सकी। लेकिन मुझे जब अशोक दास जी ने अपनी आर्टिकल भेजी, मुझे लगा कि उन्होंने बहुत अच्छा मेहनत किया है, इसलिए मैंने सोचा कि डॉक्टर अशोक दास जी का जो नॉलेज है, वो नॉलेज का हम लोग सब शेयर करें, हम लोग भी सब उसकी जानकारी प्राप्त करें। और आज डॉक्टर अशोक दास जी ने परमिशन दी है, कुछ अपना ज्ञान बांटने के लिए आए हैं। हमारे कॉलेज के बच्चों को, इंटर्नी को, पीजीटी आज सब जुड़ रहे हैं, इसलिए उनको एक अच्छा नॉलेज प्राप्त होगा। और अंत में फिर मैं डॉक्टर अशोक दास, डॉक्टर सहानी और डॉक्टर मनीष जी को बहुत बहुत बधाई देता हूँ, जिनके सहयोग से आज ये कार्यक्रम करने में हम लोग सफल हुए हैं। और मनीष जी को भी मैं आश्वस्त करता हूँ कि अगले सप्ताह फिर हम लोग एक अच्छे विद्वान के साथ दिखेंगे। जय हिंद।
हेलो हेलो
डॉक्टर सहानी जी, डॉक्टर सहानी जी, हाँ
सर,
डॉक्टर सहानी जी का आवाज नहीं आ रहा है।
यस सर, वर्ड नहीं आ रहा।
डॉक्टर सहानी जी,
धन्यवाद डॉक्टर रामजी सिंह सर, आपने आपके सहयोग से और आपके जो होम्योपैथी के प्रति आपका जो प्रेम है, रुचि है, उसके आधार पर हम लोग एक कंटिन्यूड मेडिकल एजुकेशन कॉलेज में करते रहे हैं, जीडी मेमोरियल में करते रहे हैं। यह हम लोगों के लिए और होम्योपैथी के लिए बहुत अच्छा सुनहरे भविष्य का की ओर इशारा करता है। इसी कड़ी में आपने आज के ऑर्डिनल के वेबिनार में डॉक्टर अशोक दास जी को आमंत्रित किया है। इसके लिए मैं आपको धन्यवाद देता हूं और अशोक दास जी का को इस वेबिनार में वेलकम करता हूं। अब मैं उनसे रिक्वेस्ट करूंगा कि अशोक दास जी, आप आज के जो इस प्रेजेंट कोविड है, क्योंकि डॉक्टर ललित वर्मा जी भी आपको इस मौके पर काफी याद किए थे। संयोग से आपने भाग्य था, लेकिन आपने जो इस पर प्रयास किया है कोविड के लिए, जो रिसर्च किया है, वह हम लोगों के लिए बहुत होगा। और मैं चाहूंगा कि हमारे कॉलेज के बच्चों को और हमारे जितने भी ऑडियंस इस वेबिनार में शामिल हो रहे हैं, सभी को आप अपने आशीर्वाद से, अपने प्रेजेंटेशन से हम लोगों को बताएं। मैं डॉक्टर अशोक दास जी को आई रिक्वेस्ट यू डॉक्टर अशोक दास जी कम एंड शेयर योर प्रेजेंटेशन।
Okay.
Over to Dr. Ashok Das.
Good afternoon to everybody. At the very beginning, I extend my heartfelt thanks and gratitude to Dr. Ramjee Singh, sir, Dr. Sahani, sir, and also Manish Jain for providing me an opportunity to share my knowledge and understanding with all of you. The subject of today's deliberation, different approaches of prevention in homeopathy, with special reference to anti-miasmatic approach of COVID-19 prevention. Homeopathic treatment, as you all know, is effective to cure curable cases, to palliate incurable cases, and also to prevent different diseases. Today, I want to restrict my discussion only on the scope of homeopathy in the prevention of diseases. Since the beginning of homeopathy, it has a strong track record of treating and preventing successfully the different outbreaks of epidemic of infectious diseases like scarlet fever, typhus, Spanish flu, cholera, dengue, chikungunya in the recent past. Now, what may be the different approaches of homeopathic prevention? The first of all, if we categorize, the first one, the specific prophylaxis. That means preventing a particular disease, which may be done by Genus epidemicus or by using a specific medicine like nosodes. This is one part of specific prophylaxis. There is another very important aspect in homeopathy of preventing the diseases as a whole through constitutional treatment. Please keep in mind the allopathic approach of prevention of diseases is only feasible when there is any specific antigen is being recognized. But apart from those infectious diseases, there are so many different types of diseases which has no vaccine. But homeopathy has an ample scope to prevent all other diseases by homeopathic constitutional treatment. So, in general, in homeopathy, there may be two aspects of prevention. One, the disease in general, disease in particular. Now, at the very beginning, I want to make it very clear that what is the approach of homeopathic prevention. If you keep in mind, it will be very easy to understand the whole subject. Now, please concentrate on that slide. To produce a disease, we need an abnormally susceptible host, certain pathogenic agent, and in a particular environment. This is the concept of the modern medical science. That a disease is being produced by an host when he is exposed to certain pathogenic agent like bacteria, virus, or any other microbes. That means to produce a disease, it needs three things. One, host, susceptible host. Next, the pathogenic agent, and environment. This is called the disease triad in modern medical science. Now, if you consider our homeopathic approach, that how disease occurs, you say we need one that is an abnormally susceptible host. That is very, very important. This is the host factor. The next one is, according to to produce a chronic disease, it needs miasm and it needs certain environment. So if you go through the organon of medicine, you will say there are certain factors like accessory circumstances, and the interaction between the miasm and accessory circumstances leads to the development of a disease which causes an abnormality in the particular host. And according to homeopathy, the cause is the dynamic derangement of vital force by some factors, miasmatic factors, factors in relation to the accessory circumstances. So this is the concept of homeopathy. And very important one, that this host factor is more important in homeopathy. I can give one example. Suppose we have certain seeds of rice. Now, if you throw these seeds on the floor of this particular room, there will be no plantation. But the same seed, if thrown on particular field with water and suitable environment, that leads to the plantation. So, what is important? That seed has the capability to produce the plantation, but it needs certain environment. Similarly, in homeopathy, the bacteria, the virus, or other microbes can only produce a disease provided his vital force is deranged. So long the vital force is functioning normally, there will be normal immunological reaction, there will be normal production of antibodies or other immunological reactions, and they will successfully destroy the particular microbe. But if the dynamic derangement of, if the vital force, so long even normal, that is possible. But if the vital force is deranged dynamically, then the particular bacteria, the virus will able to produce the disease because the normal immunological reaction will be disturbed. So if you think of categorically, the derangement of the vital force, the derangement of the immunological reaction of the host, and then only the bacteria or virus or any other microbes produce the disease. So what is important in homeopathy? That although the different microbes has the potentiality to produce the disease, but so long the vital force is functioning normally, so long his susceptibility is normal, the bacteria, the virus, or any other microbes will not be able to produce the disease. And that is very, very the important thing in homeopathy. Please keep in mind, the susceptible host is important to produce a disease. Now, as regards the pathogenic agent and the environment, the concept remains the same. So, if you think of the whole homeopathic approach of prevention, we see what is the allopathic approach. The allopathic approach is to treat the host by certain vaccine. But in homeopathy, we can treat that host by different approaches, like constitutional treatment, by using Genus epidemicus, by using nothers, by using anti-miasmatic medicines. This is in relation to the host. But as regards the environment, as regards the pathogenic agent, the concept is the same. So we need to stop the transmission of the virus or microbes by following personal hygienic measures, and that is same as allopathic approach. To take the environmental hygienic measures, the same like that of allopathic approach. So what is the difference between allopathic approach and homeopathic approach? Only in relation to the treatment of the host. So in our prevention, we must take the help of all the measures advised by the allopathic physicians and modern scientists as regards environmental sanitation, as regards stopping the transmission of the virus by various measures. So there is no difference of opinion according to homeopathic philosophy also. Only what we differ only as regards the treatment of the human host. Now please keep in mind, in homeopathy, both the curative treatment and prevention based on the same principle of law of similia, and the approach is individualization. Please keep in mind, in treatment as well as in prevention, our approach based on the law of similia, and that should be applied to the process of individualization. And as you know, our treatment is based on the symptomatology. Please keep in mind the symptomatology. But what is most important to us, that homeopathic treatment is not based on causative pathogen. Please keep in mind, homeopathic approach is not based on the causative pathogen. So that in spite of change of nature of the virus, in spite of the development of different variants of virus due to genetic mutation, homeopathic treatment, as it is based on symptomatology, so we do not depend upon the causative organism is not the target of our treatment. So it will remain, homeopathic treatment will remain effective in all cases, so long we are prescribing on the basis of symptomatology of the individual patient and following the principle of our concept of individualization. And that is very, very important in homeopathy. Now the first one, the constitutional treatment is the best preventive for all types of diseases, both acute and chronic. But it is not practically feasible for mass treatment in an epidemic. So, the scope of constitutional treatment is almost limited to the physician's own clinic. It cannot be advised to the masses. Next. The most classical and well-known, all of us know that an epidemic from homeopathic angle should be or must be treated by Genus epidemicus. This is the classical approach. Another approach is to treat a particular epidemic by the same nosodes, by preparing the nosodes from the same pathogen which produced it. Please keep in mind, using nosodes which produce, which is the causative pathogen of this particular epidemic. In fact, this approach, many of us said that this is an isopathic approach. But there are certain homeopathic philosophers like Stuart Close. Stuart Close mentioned that whenever there is potentization, it not remain the same, it becomes similar. There are certain changes when there is potentization, because in homeopathy we are using potentized medicines. So although while we are potentize the pathogen, there is certain change. So we cannot say that this is isopathy. And the next one that is more important at the present day, the anti-miasmatic medicine in case of epidemic diseases of chronic nature. Please keep in mind this word, that epidemic diseases of chronic nature, then we need to think of anti-miasmatic medicines. Now I want to throw some light on Genus epidemicus, because most of all you know why a commonly indicated curative medicine in a particular epidemic selected on the basis of totality of symptoms, common to all and suitable to all cases, as you all know. But what is most important, according to Hahnemann, that each epidemic is a new epidemic. It is restricted to a particular geographical area at a particular time, and you have to find out the symptomatology of that particular area at that particular time. That is very important, and that has been explicitly explained in Aphorism 241. I don't want to specifically read out that one, but all you know this basic concept. Some problem.
Any problem?
The slide is not coming.
It got it?
Stop my presentation.
Next, you click only the next. Next has appeared, Genus epidemicus. It has appeared, sir.
Yes, sir. This coming?
Yeah, coming. Genus epidemicus.
Yes, sir, but it is not coming, sir.
I can move the slide. You can tell me the next. I will move the slide.
Yes, sir. Next slide. Next slide.
Genus epidemicus. Over.
Yes, sir. After Genus epidemicus.
Organiser of medicine 241.
Yes, next. But it is not visible to me, sir. Why?
I don't understand that. What you are seeing?
A Genus epidemicus.
At Genus, it is not moving forward in your.
No, not moving forward.
You have left the room, sir.
Yes, sir.
You refresh and come again.
Not coming.
You got, sir?
No, sir, no slide. Okay, I'll try.
Okay, I'll keep. You are getting the slides or not?
No, no, not getting the slide.
But I am able to move, sir.
I can again come or something.
Yeah, I can see the slides. If you wish, you can reconnect yourself.
Reconnect. I can go back.
You have to go reconnect yourself. All audience are requested to please wait. Dr. Ashok Das is joining again. His network problem is there.
Sir, there is some net problem, sir. There is
Calcutta is raining. Uh, Calcutta is raining, so he just got cut and he will be coming back. फिर से आ रहे हैं. बारिश हो रहा है. यहाँ पर लगाया हुआ है. टेंशन घटता जा रहा है। Please wait, he is getting connected again. Meanwhile, we can speak about the COVID situations right now. What I feel, treating the COVID patients as well as preventing is very important. And as a homeopath, I can only say that it is quite possible to treat all types of the COVID patients, even the serious or the most advanced cases. We have personal experience of treating the cases which were declared RT-PCR was positive, and only going through the presenting symptoms is very important. Presenting symptoms means what the patient says, and interpreting them for the rubrics and the symptoms, you can get the medicines. Because usually the COVID patients are accompanied by the feverish condition, and this during the fever, usually what happens, we look for what is the temperature. But what my approach for this is to see in which area there is no temperature. Some part of the body are heated and some part of the body are not heated. If you concentrate on this aspect, you can understand the peculiarity of the symptoms of the individual case. Like in some cases where I have observed So sorry, there was a network problem there. So I was talking to you about the problems that you can look for. Very minute observations and minor observations is required. Then you go into the yes, sir. Yes, sir. So friends, I was sharing to you about how to make the very simple and minor approach in your observations. Your observation is very important. Instead of looking for the curves and things, they are important, but by the side, we have to see how the things are happening, how the fever is appearing, how the fever, where is the temperature and where is not the temperature. This is very important. So you have to look for the temperature area, you have to look for the coldness and hotness of the part, and this is the first steps that you can go for the individual case, in the individual cases. Going through the general name nomenclature of the medicines as a therapeutic basis, I feel that it is most useless. You may not be able to utilize the medicines homeopathy very properly. Then you can see the behavior of the patient during the COVID fever. Naturally, when in the present phenomena, when we see that the patient gets fever or cough, they apprehend that they are COVID positive and immediately rush for the RT-PCR. Sometimes it is positive and sometimes it is negative. But irrespective of that being it is positive or negative, you have to concentrate basically as per the homeopathic principle on the type of the symptoms that is there. Type of the symptoms and the nature of the symptoms and relativity of the symptoms is very important. So first I told you that you have to be careful about the part of the body which is hot and part of the body which is cold. Then associated factors with the heat. Associated factor with the heat, like fever is coming with the chill, sometimes it comes with the heat, and sometimes it comes with the, so the progression of the heat is very important. Progression of the heat is very important. You have to look for the how the things are getting, things are moving, how the symptom, how the fever appeared in the life, and how it is staying, and how it at what time. So time factors and the modality factors for the fever is important. Then associated symptoms during the fever. Every fever is associated with some of the physical or mental aspects. Like during the fever, the thirst will be not there, or there will be more thirst. But while observing for the thirst, it is not only that you look for the thirst is there or not. We have to look for whether there is a dryness of the mouth. If the dryness of the mouth is there and not the patient is not feeling thirsty. So dryness of the mouth, thirstless. Then dryness of the mouth with thirst. And what amount of the water he is taking. He may be taking large quantity. He may be sipping like a tea. These are the aspects that you can see. And then along with that, you can see that there are the cough associated with the fever. There are the rubrics in the repertory. So instead of concentrating on the fever, you have to go to the, you have to have a overview of all of the chapters, where sometimes the patient complains, sir, there is a very burning sensation in my feet, and the heat is there. So he is feeling the heat, especially in the foot part and in the sole. So you can have the heated feeling of the sole or burning in sensation in the sole during the fever. Likewise, cough during the fever, sneezing during the fever. So even you get it associated with this, this becomes very important understanding for the going through the books, through the symptoms. Then try to see the mental aspects, how the patient is feeling. And naturally, the fear is very common nowadays. Fear and anxiety, what will happen to me, what will happen to my life, or what will happen to my family, what will be about my livelihood, and so many thoughts comes. Some patients are still with this fear, they have the courage. See, we have to console the patient, we have to make them understand what is good, what is bad. This is very important for us to understand what is good and how they can be. Encouragement is important. The counseling part is very important at these situations with this. I had a patient where I felt that there was a cough while it was eating, and it was during the heat, and the rubrics is there. The eating difficult, swallowing difficult while coughing, or while heat during, and then we got very good medicines like that, or any medicines from the Mathematica or the repertory will be useful for this type of the situations. So friends, keep observing the symptoms. It is very important. Observations for the symptoms are more important than having the thinking about the medicines. First, observe the symptoms and then look for the medicines. I hope Dr. Ashok Das has joined now, and he will be just open your audio and video, sir. Dr. Ashok Das. Dr. Ashok Das. हाँ, तो आ गए हैं।
मतलब आपके तो बात कर रहा है, इसके लिए नहीं, I can't be able to enter.
No. तो कौन आता है There is a great network problem at Kolkata. A heavy rain is going on. So sorry for this presentation. Still he is trying. We'll wait for a few more minutes to see him enter into the room. So friends, instead of getting panicky, you look for the mental state, you look for the physical general, and you look for the particular characteristics particular. Now what I mean to say about the characteristic particular is that it is just the general feature of the patient, and it don't take too much time, because just nowadays we are prescribing medicines as a telemedicines only. The patients are not attending to our clinic, but they are calling us through the telephone and the video calls, and we are asking, and on the video calls and the telephone, taking too much symptoms is not very much easy. So we cut short somehow, and we focus on the characteristics particular, and then what type of the person he is, what is the mind setup he is, and what are the contrasting situations during the present symptom. So characteristic symptoms means those symptoms which are in contrast to the general. Like during the thirst, during the fever, if you have thirst, so with the body is hot and the thirst is there, then it is very common. But if it is thirstless, it is uncommon. If the mouth is dry and the patient is feeling thirstless, it is uncommon. So you look for something which is against the situation, against the time, as well as against the presentations of the life of the patient. So this understanding you have to keep in mind while you are discussing, while you are observing on these type of the symptoms. Now, what you can do in the present pandemic situations? Most of the symptoms are very common, and for that it is important to draw the genus epidemicus. And after seeing some 5 to 10 patients, you can find out what is common there. What is common? So on that basis, you can draw a repertorial analysis for that, and with that you can get some medicines. And now you have to only choose the medicines, select the medicines from that group of the therapeutics that you have created at the moment of the present situations. And Dr. Hahnemann meant about this genus epidemicus to create a small repertorial analytical therapeutic features for you. With that, a few medicines coming in common, and among the few medicines, I think you will be very rare patients will require the rare type of the will deviate, but most of the patients during the pandemic situations, they have the similar type of the presentations. So friends, you have to be observing, and observations and patience is very important, and the encouragement given to the patients are very important. What I have understood during these cases, almost 1 or 2 patients we are getting for the COVID positive patients every day. I have started with all of them. We are getting the Brainia patient, we are getting the Rustox patient, we are getting the Pulsatilla patient is very important also, because during the breathlessness and the lungs infections are there, this Pulsatilla is very important. Then anacardium, I have given anacardium to 2 of the patients, and they had a miraculous escape from this situations. Then in another case, I found the Nux vomica to be very useful. Why? Because the drug, where the patient start looking for the allopathy, homeopathy, Ayurveda, and every type of that. So they are so much worried at that situation. This makes them panicky. And with this panicky situations, this arnica, and sometimes it is arsenicum, sometimes it is the phosphorus is also very important during situations. In myself, I found the lycopodium to be working very greatly with my gastric disorders are associated. In the second phase of the pandemic situations, we have the gastric presentations. And with this, we are getting more and more symptoms related to the gastric region also. The diarrhea during the heat, during the intermittent fever, during the remittent fever, it makes a difference. Then what type of the watery diarrhea, the stool becoming watery, it is important with this. So friends, you have to look for this. It is very important for you to understand the situations. I'm just trying to
Yes, sir, get the link, and I'm trying to get the slides. Yes, sir, yes. Or only if it is some problem in slide, I can say directly, sir. I'll try to. Yes, sir. Yes, sir. Yes, sir. Okay. Okay. Yes, sir. Okay, sir. Okay.
Sir, you are able to listen to me?
Hello.
You are able to listen to me?
Yes, sir.
So now you put on your video also, if possible. You are able to see your slides?
Yes, sir. I'm clicking on that.
So you can start talking, speaking, and moving the slides. Or if you say that, I can move the slides for you.
Sir, is it? You can see the slide. It is not. I cannot see the slide.
I'm seeing the slides. Slides is with me.
Hello.
You have again left.
Sir, is it audible?
You are audible. Audible.
Okay.
Yeah.
As I am discussing earlier, sorry for the interruption. While I am discussing about the Genus epidemicus, please keep in mind, I already told you that we have to find out a group of medicines and in a particular epidemic, if you go on collecting all the symptomatology, we may get different medicines, out of which you have to select one of them which is most commonly indicated and more effective in consultation of the mathematical. That means what I want to emphasize, that if you collect all the symptoms in a particular epidemic, 2, 3, 4, 5, 6 like medicines all may be indicated, but out of which you have to select the most similar medicine. That is important. And that most similar medicine should be considered as the genus epidemicus of the particular epidemic. Please keep in mind, that is important. So it is related to a particular part at a particular time. And Dr. Kent told that this is known as the epidemic remedies of that particular epidemic. And according to Dr. Kent, he told that if you treat 20 patients, out of which you can select the genus epidemicus. But in this regard, I would like to, next slide, sir, Hahnemann's lesser writings, page 377. Hello, sir. Hello? Hello? Sir, are you audible? Hello? Hello?
You are audible to me, sir.
Okay, sir. So one thing I'm doing, I'm go on talking. Yes, sir. Okay.
Yeah, keep on talking, sir. Yeah.
In page 377 of Hahnemann's chronic lesser writings, he told that medicine which can cure an epidemic disease at the beginning should be considered as the preventive. Please keep in mind, medicine which can cure an epidemic disease at its beginning is very important. So that should be the medicine which should be the preventive. So cure an epidemic disease at its beginning. Next one, as you already know, there is use of nosops in the prevention of epidemic diseases like diphtherianum, use of anthracinum for the prevention of anthrax, use of oscillococcinum for influenza-like illnesses. In this regard, I must mention the very successful use of nosops in the prevention of leptospirosis in Cuba. In the year 2017, 7, there was a tremendous dangerous epidemic in leptospirosis in Cuba. There was no allopathic preventive medicine on leptospirosis. So a homeopathic prophylactic formulation was prepared from dilutions of 4 circulating strains of leptospirosis. Please keep in mind, they have prepared a formulation collecting all the different strains of leptospirosis, and they have administered orally to 2.3 million persons in high-risk epidemic region affected by leptospirosis. And it was found that after giving this homeopathic formulation of leptospirosis bacteria, there is complete prevention of this particular disease, and that has been recorded. So aerosols can be used for preventing a particular epidemic. Whether you can say this is homeopathic or isopathic, but it will be very helpful to prevent the particular disease when there is no other alternate way. Now, I want to switch over to another concept of Hahnemann, that is the anti-miasmatic approach of prevention of an epidemic disease of chronic nature. In this regard, I refer Aphorism 241 to 244. So I will give you only the gist of these 4 particular aphorisms of organology. Please keep in mind. Now, what is the gist? Hahnemann told that if an epidemic of intermittent fever is not cured by general common medicines, if it recurs and if it is of chronic nature, then it should be treated by anti-soric medicines. Please keep in mind, Hahnemann advised that in case of epidemic of intermittent fever of chronic nature means which is recurrent, persistent, not being cured by some indicated known anti-soric medicines. So if they persist, those cases should be treated for radical cure by anti-soric treatment. So this is a advice of Hahnemann to treat epidemic of intermittent diseases of chronic nature. Please go through this particular aphorisms. Now, this is the basis of homeopathic approach of Hahnemann. Now, I want to translate this theory to practice, how that theory can be practiced in homeopathic clinical practice. In fact, the first successful application of anti-miasmatic treatment in the prevention of Japanese encephalitis was done in Andhra Pradesh between 1999 to 2004. Japanese encephalitis in Andhra Pradesh in 1999 to 2004. What happened in Andhra Pradesh? There was an epidemic, and that was all the symptomatology was repertorized, and different medicines were indicated. And there is no consensus in the drug of choice and homeopaths. Like different medicines like opium, helleborus, stramonium, etc. are prescribed as prophylactic with some partial result. Very important one. Although they are indicated on the basis of the symptomatology, but prophylactic effect of those medicines are temporary, and there is every recurrence of the disease. Then Dr. G.L.N. Sastry, a pioneer in the public health homeopathy, sought a consensus among homeopaths And he emphasized the need of radical approach towards the disease by anti-miasmatic treatment. Please keep in mind, when oil-indicated medicine fails, in spite of their best effort, then Dr. Sasti, as it is a Hahnemannian concept, go for anti-miasmatic medicine. Dr. G.N. Sasti had focuses on the cause of brain fever and searched for answers to prevent Japanese encephalitis by not on the Ashok medicine, but on the basis of some anti-miasmatic medicines. Please keep in mind, that is important. So what happened in between 1993 to 1999? There was about 5,308 recorded cases in Andhra Pradesh, of which 1,511 resulted in fatal outcome. And in spite of vaccination, they failed to control this Japanese encephalitis. Then Andhra Pradesh government sought the help of homeopathy in combating this epidemic. Now what happened? Then Dr. Sasti adopted a protocol of BCT. BCT means belladonna, calcarea cup, and tuberculinum. Belladonna was also indicated on the basis of the symptomatology, but that also failed to control and prevent completely. That's why he wants to find out a solution by the help of anti-miasmatic medicine. But belladonna is the first one from vegetable kingdom, which is complemented by calcarea cup, another medicine from mineral kingdom, followed by tuberculinum, that is the nosocs, and all the three are complementary to each other. So in selecting the medicine, Dr. G.L.N. Sasti considered the similarity of symptoms, the complementary relationship, the virulence of the disease, and the underlying miasm. And this was known as BCT study. Now, what happened? That when BCT was given to the large population of Andhra Pradesh of the affected area, after following this one, there is complete eradication of this particular disease. Please keep in mind, there is complete eradication of this disease from Andhra Pradesh. How it was given? What the dose? The belladonna 200, the first, second, third days, 1 dose each. On the 10th day, and on the 25th day, tuberculinum 10 mg. And all children, age group 15 years, was given this medicine in the month of August every year for 3 consecutive years. Because just after that, usually the epidemic starts. That's why every year, for 3 consecutive years, they have administered this particular BCT medicine.
Sir, you are here in the room? You are here in the room, sir? You are not in the room now? Yeah.
Hello. Sir, am I audible?
We are able to listen to you, sir. We are able to listen to you.
Am I audible?
Yeah, you are audible. Continue, sir.
So what happened? Just if we give any statistics, in the year 2000, there was reported case of 343 cases. The number of deaths, 62. In the next year, 2001, there were only reported 30 reported cases, 4 deaths. In 2002, there is only 18 cases of Japanese encephalitis and no death. And in 2003 and 4, no case recorded. And that study was done by the government of Andhra Pradesh through population survey. And government of Andhra Pradesh accepted this particular success of prevention of Japanese encephalitis by homeopathic medicines of BCT. But what is the conclusion of that project? That in an endemic and epidemics of any infectious disease, we need to study from the miasmatic viewpoint to understand their virulence, change of pattern, and recurrence. In fact, similar thing happens at present in relation to the COVID-19. I will come to this point afterwards. Now, before that, there is another history. What I told you, this statistics, it was published in Liga News, December 2018, and the article titled Efficacy of Homeopathic Prescription in the Prevention of Japanese Encephalitis between 1999 to 2004 in the state of Andhra Pradesh, India, written by Dr. Srinivasulu Gudugu. This is the person who published this paper. Now, before that, there is also another history, and you must know that history. What happened? In fact, in the year 1994, there was a new outbreak of Japanese encephalitis in Kerala. Dr. Ramjee Nair was the principal of Trivandrum Homeopathic Medical College. And as a principal, when there is an epidemic, he was called by the government of Kerala, and by their instructions, they also sent the team to different allopathic medical colleges to find out the symptomatology of those cases. And on repertorization of those cases, the belladonna was also indicated. But then Dr. Nair consulted Dr. Sastry, because Sastry was the then superintendent of Hyderabad Homeopathic Medical College, and he was engaged in the treatment and control of Japanese encephalitis in Andhra Pradesh since a long time. Now there is a discussion between Dr. Nair and Dr. G.L.N. Sastry. Dr. G.L.N. Sastry advised that although belladonna is indicated, but what is our experience? That they failed to control. So Dr. Sastry advised Dr. Nair, and though both of them discussed together, that why not to accept or why not to adopt a anti-miasmatic approach, and both of them agreed that the BCT will be the most suitable one. After this, Dr. Nair distributed these medicines in all 3 affected districts of Kerala through homeopathic medical officers of the government level, and the result is very, very successful. There was no incidence of Japanese encephalitis in the next year. Please keep in mind, this is in the year 1994. The concept actually in between Dr. Sastry and Dr. Nair implemented first in Kerala successfully to prevent Japanese encephalitis, but that was not published because during that time publication is not so much in vogue or originated. But after 5 years, the same BCT was applied in Andhra Pradesh in between 2000 and 1999 to 2004. That means 1994 in Kerala, after 5 years, implemented the same BCT protocol in Andhra Pradesh and successful to control and prevent completely the Japanese encephalitis. So this is the background of that how anti-miasmatic approach of treating a particular epidemic can be useful for prevention. So that's why, please, another one I want to emphasize that not only the anti-miasmatic concept was used, but also that's why I want to say a few words regarding the complementary relationship as regards the second prescription of Dr. Kent. As you all know, the complementary medicine means the medicine that completes the cure which other begins, but unable to effect is known as the complementary. Now this complementary medication in second prescription is applicable both in acute and chronic diseases. So that particular concept may be extended further in the prevention of epidemic diseases of chronic character. Why? Because the basic rules of treatment and prevention in homeopathy are the same. So to prevent a epidemic disease of chronic character means the recurrent nature, persistent nature, and having long-term after effects. Please keep in mind three things: the persistence of the disease, the recurrence of the disease, as well as the long-term after effects of the disease can be considered as other features of chronic character. And that type of epidemic can be managed by anti-miasmatic medicines. That's why it may be a potential approach in homeopathic prophylaxis. Now coming to the coronavirus, please keep in mind I am concentrating on corona now. Perhaps you know the first scientific advisory committee of CCRH advocated arsenic album 30C as the preventive on 29/1/2020. Please keep in mind 29 January of 2020. Without treating not a single case of COVID-19. In fact, the first reported confirmed case of COVID-19 published, that is on 30th January 2020 in the state of Kerala. What I want to emphasize that CCRH and the ministry advocated arsenicum album 30C on the basis of symptomatology of the COVID-19 in different other countries. So, as you know, there is no such treatment. So that is without any treatment and clinical trial, they advise on the basis of the symptom repertorization.
Yes, sir. Continue, sir.
Arsenicum album 30 daily in empty stomach for 3 days, and now it has been to some extent modified.
Continue, sir. Hello, you speak, sir? You speak, sir? You speak, sir? Hello? Dr. Das? Not now, sir. Your mic was uh, uh, you just see that your audio is on or no off. Both are on, but we are not able to listen to you, sir. Not able to see you, and voice is also not coming, sir. How much? Then I don't know why it is there, but here also sometimes the rain was there, but I am stable here. We see you there in the room, but your link is there, but you are not in the voice, and both are not coming. So can you re-click the voice? So, try to re-enter the room. Okay. Since Dr. Ashok Das is facing problem in getting connected because some of the cause, I have tried to show all the slides that he had sent to us, and I hope we can get more time for him another time so that we can be able to. So with this, I thank Dr. Ashok Das and Dr. Ramjee Singh sir for having opportunity for us. It was the nature's fate that we couldn't have the completeness of this session. So with this, we are ending the session, and we hope that next time we can have many more better presentations. Thank you all, and thank you all for who are waited and patiently listened to this whole of the webinar. So with this webinar comes to an end. I thank P. Jain, Homeopathy 360 and GD Memorial Homeopathic Medical College for providing an opportunity to listen to some part of the Dr. Ashok Das views and to see some of the slides also. Let's hope for a better in the next coming session. Thank you very much.